Obviously, the line is crossed when it comes to violating HIPAA, but are brand partnerships crossing the line?
There are no clear guidelines around this. Again, this is part of why, part of what we highlighted in the article was just that there are no real guidelines around this, and that's why it's so tricky. Of course, there are certain laws that exist to prevent medical practitioners from getting kickbacks on pharmaceuticals, for example, that they might recommend. But like by and large, if somebody who is a dermatologist or a licensed nurse practitioner in dermatology, like the one who we featured in the article, if that's a person who is just recommending over-the-counter drugstore products, whether they're collecting money from that or not, like, is that a problem? It's absolutely not clear, and many people have differing views on that. That said, one of the people who we interviewed for the story, who is overseeing, he's a practicing cardiologist who's overseeing all of Google and YouTube's healthcare work. He is somebody who, again, himself as a practicing cardiologist, he sees the value in medical professionals actually being paid for what they're putting on social media, because all of these creators, one thing they say in common is that it takes a lot of time to put this content out there. It takes a lot of time to ensure that there's good authoritative content out there. And the perspective of the guy who's overseeing YouTube and Google's health arm is that doctors are paid for their valuable input in real life, whether it's, in the surgery room or it's in the office. And they should also be paid, in his perspective, for the time that they are putting into putting things out on the internet for the greater good of the public, to better inform people about their health.
Based on who you talk to, what has the response been from healthcare workers over these kind of blurry social media practices and policies?
Healthcare workers overall have said that it's incredibly frustrating and that it needs to be talked about more, which was, part of what we highlighted in the article was that the three main reasons that healthcare providers are looking to get into social media outside their day job in the first place are really: one, to reach more patients; two, to make extra money outside of their jobs; and three, to also have a creative outlet where they can be sort of humanized and be themselves outside of the day-to-day stressors of their job in medicine. And I think that the resounding, overarching message that I got in speaking to creators who have tried to do this and have run into issues with it is there really needs to be more conversation about kind of where we go from here and the possible benefits, and how we can ensure that if we are pursuing social media outside of our jobs, that the risks are not going to outweigh the good that they can do with these platforms.
Do employers really have any legs to stand on when it comes to firing healthcare employees based on these half-baked policies that they come up with?
Well, again, it's not for me to opine on that, but I think that employers are trying, they are trying in many cases to re-examine these policies. They are trying to update the policies. I think a lot of times what happens, though, is that technology is advancing so rapidly, and new platforms are coming up so frequently and becoming so viral so quickly. I mean, look at TikTok. Even just a few years ago, it really wasn't on the radar of many people in the United States. I think what's happening is that these practices, medical schools, these medical organizations are well-intending and well-meaning in the sense that they do want to figure out how to put social media policies into place, how to enforce them, how to make them a little bit more granular, so that they're not just telling people, don't violate HIPAA or be sure to be professional, which is extremely broad. I think that despite these good intentions, the technology is so rapidly evolving that it's creating more specific policies for the medical providers or for the hospitals, for example, to sort of hang their hats on. It's making it really difficult to do that.
From who you've talked to, is there any indication that these policies will catch up anytime soon?
It seems like the fact that, YouTube, which has YouTube and Google, which again, their health arm is being run right now by somebody who is a former high-ranking government official who worked at the Department of Health and Human Services, who also is a practicing cardiologist himself, and who now has recently launched this program where YouTube is going to be elevating and labeling and boosting videos that qualified medical creators are posting to the platform. I think that we are sort of at the beginning of these policies being revisited. If anything, we're sort of at the beginning of them being written altogether. just because the policies that exist now are the same ones that really existed, within the last 5 or 10 years. And we're in a completely different technological landscape now than we were even 5 or 10 years ago.
Alexandra, thank you so much.
Thanks so much for having me.